health sector was the one that had to obviously step up the most, because they had to come up with a vaccine, they had to help a lot of people because it was a virus and it was something unknown to mankind. To give us a further insight into this field, I would like to call our next guest speaker, Dr. Saira Siddique, who has worked on this specifically and will be talking about how we look at healthcare after COVID. So please give her a big round of applause.
Hello, Bahria University today. I'm Dr. Saira. So when we think about COVID, I don't want to talk much about health technology because I think health technology has been there. So I don't want to say that it's the new normal now. I think it's simply updating what was there in the older times and using it in the modern time and using it properly rather than just brushing it in the carpet and saying कि जी हमने कुछ नया बनाया है. But at the same time, I have also asked people the same question. For example, Rome जल गया, मतलब उसके जलने के बाद क्या हुआ? कोविड आया. कोविड ने 2 साल हमारी जिंदगी ऊपर नीचे करके रख दी. But what we have learned from COVID, do we ever realize that? What are the findings? What are the learnings? क्या सबसे पहले हमने इस बात को appreciate करना नहीं सीखा कि don't take things for granted? Love what you have, strive for excellence, live on limited resources, right? So many a times the message I want to give to the students here is that we always think कि जिंदगी में कुछ अच्छा शायद इसलिए ही नहीं हो रहा कि I'm not worth it. क्या मेरे ऊपर कोई खास मुसीबत है जो मुझसे काम नहीं हो पा रहा? But many a times the storms in our life, they don't come to disrupt our life. They just come to clear the path. Now coming to the new hope, let me give you an example. Not example, but it's a fact of my life. 4 साल पहले, exactly 4 years back, I think the last sound which I heard was the screeching of my car's tire. I was CEO of Button Sehat Card, the so-called health card, which is now considered to be the best political slogan in Pakistan. So after coming back from York, after doing my PhD in health economics, I came back, picked up by the government to design this program. And I was enjoying, I was 39 at that time, and I was enjoying the best time of my life, the importance, Gadi Aage, Piche, Prime Minister, CM, all this. And one day I'm on the road, on my way to Lahore from Islamabad. It was 4 a.m. in the morning, and the driver suddenly went to sleep. And I was sitting in the back of the car, और आखिरी आवाज़ जो मैंने सुनी वो screeching की थी टायर की. And then the car hit the side of the road, and then before I even realized, it toppled and went into a deep ditch. So simply, basically surrounded by the dust. It was a dusty chaos and nothing else. And the next sound I hear is the beeping sound of ICU machines. I was on ventilator for 6 days before I gained consciousness. All I could hear at the time was the beep and my family, my kids, my husband and my parents calling out my name. Without realizing that it was 6 days I was in coma. 2 months it took me to come out of ICU to move to a normal hospital bed. 4 months before I could walk with support. 6 months before I was able to go back to my home. But neck down, I was paralyzed. So was it the end of my life? The so-called great Dr. Saira, जो कि इनकी 21 साल में शादी हुई, फिर भी उन्होंने MBBS कंप्लीट किया 2 बच्चों के साथ. उसके बाद वो मास्टर्स करने अपने लंदन स्कूल में चली गई. Wow. She came back, joined the biggest program जो उस वक्त USAID ने फंड किया हुआ था. Joined German government, worked for Capital Development Bank, went for a PhD, did her PhD. So started the biggest program of Pakistan. So was it the end of my life? Everyone said the same thing to me. Bichari khatam ho gayi. And I was only 39 at that time. So क्या वो बिचारी वाकई खत्म हो गई? Yes, वो खत्म हो चुकी थी. So everyone around me made sure to make me realize that yes, तुम खत्म हो गई हो. And with my kids coming to me, my elder daughter was just finished her A-levels at the time, and she was preparing for A-levels, and she said to me, आपने उस वक्त आके एक्सीडेंट करवाया जब मुझे आपकी सबसे ज़्यादा ज़रूरत थी. And I was it my fault? But people around me didn't realize that. My younger daughter, she was in O-levels at the time, and she said, you know, I'm missing the best part of my life because of you. So the people whom we love, who also love us back, but when you are in a state when you are dependent on the others, you don't find hope around you. So what is the new norm? I emerged out of it, but because मैंने जो देखा लोगों के साथ होते उसके मुकाबले में ये तो कुछ भी नहीं था जो मेरे साथ हो रहा था. I was on a VIP bed. I was flown out of the country for my surgeries 8 times. I was always rehabilitated with the support of my family. जो कि शायद इमोशनली उस वक्त खुद अपने ट्रॉमा की वजह से मुझे प्रॉपर्ली सपोर्ट नहीं कर पा रहे थे, मगर उन्होंने हर तरीके से कोशिश की. मगर इस सारे प्रोसेस में जो चीज़ मैंने देखी, bigger places like all the big names, think about those hospitals in Pakistan. वहाँ पे मैंने दवाई की एक एक पत्ते के पीछे लोगों को रुलते देखा, पंजाबी में कहते हैं. वो मेडिसिन खरीदते थे और जब मेडिसिन की प्राइस पता चलती थी तो कहते थे ये वापस ले लीजिए, हमें सिर्फ एक पत्ता दे दीजिए. All day they would travel for about 500 kilometers to get a consultation with a doctor. Lab test, simple lab test, complete blood picture. All this can be easily be provided in their vicinity. But because there was no accessibility, they didn't have the money to buy the healthcare, so they were made to come to the bigger cities. वहाँ के ख्वारी करने के बावजूद भी they couldn't afford it. So when all this was happening to me and I was recovering, so one day when I still remember when I went for my physiotherapy session, and I was like talking to the physiotherapist, and I said, how do you rehabilitate the people? He said, actually by rehabilitating them mentally first, so start using your brain. So उस वक्त I thought, okay, what can I do with my life now that everyone is disappointed with me? मेरे बच्चे मेरे से disappointed हैं, my husband is not happy, my family is not, they're just waiting for me to be gone, maybe. So what should I do? Then I started using my brain and it really helped me. So I thought of how can we make sure the technology इन लोगों तक पहुँचे healthcare को लेके जहाँ अभी तक access नहीं है. Because if you start developing brick and mortar structures everywhere, we don't have the physical space to develop those brick and mortar structures. Started talking to different people. I was a health economist, I was a public health practitioner, I was a medical doctor. I never knew anything about coding, about software, about mobile apps, web apps and all this. So started discussing with different people and they told me that you can connect a doctor with a patient while they are sitting thousands of miles away. And I asked, how? Simply by a video consultation. So the idea of connecting customers with the patients came at that time. Then what else is needed? You know, आपके general practitioner से बात होगी, you need specialists, the next level. Can we have a pool of specialists who can provide healthcare services to those people? Yes, we can. There are so many available in the cities. The idea is to connect them to the population who is not having access to healthcare services. Can we deliver medicines to them at the doorstep? अभी सुबह मैं बात सुन रही थी थोड़ी देर पहले जब it was talking about the businesses, खादी की बात होती सब कुछ अरसा पहले क्या खादी ने सोचा था कि उसका मटेरियल जो है वो ऑनलाइन बिकेगा. कोविड चेंज है. पहले जब तक हम कपड़े को हाथ में लगाते थे हम उसकी क्वालिटी पता नहीं चलती थी, हम उसको खरीदते नहीं थे. So why not if the e-commerce, quick commerce, last mile delivery can work for others, why can't it work for healthcare? So from there we started using my own money, whatever was left with me. So and everyone was against it. पागल हो गई, जो बचा था वो भी लगा दोगी. I said no. I think I'm a strong believer of what I want to do, and maybe this is the last thing which I want to do before I die. So I spent about $500,000 from my own pocket in developing a platform which is now Pakistan's first integrated virtual healthcare platform, which is serving a customer base of more than 100 million people. Just in 21 months, we have created 418,000 customers remotely by connecting with them with the best doctors around, by providing them medicines at the doorstep, by having their lab tests delivered at the places, and only when required, they go to a hospital to get admitted. So we are actually reducing the cost of healthcare services by 60%, and this is based on the analysis of the real-time data which we are getting from the customers. For me, it was something which was really, something which actually मुझे लगा जैसे मैंने ज़िंदगी में कोई ऐसा काम किया है कि शायद अब मैं कुछ देर की तरफ जा सकूँ. And that was the point, and I said, okay, there's no giving up. Now I want more money. I need to make it bigger and bigger, so that we can expand it regionally, we can expand it globally. And I started searching for investors. और सुना है कि वेंचर कैपिटल जो इन्वेस्टमेंट करते हैं वो ख्वातीन तो करते ही नहीं हैं. And that's what I faced as well. So when I started pitching to different investors, it was December last year. रात 11 बजे कॉल होती थी, सुबह 6 बजे कॉल होती थी because of the different time difference with American investors. And I pitched to 168 investors to get my investment. It was not easy for me, and I was still recovering. But with the help of the team, we were doing it, and without letting it go, because I was a strong believer with the support of Allah that inshallah will be able to make a difference. And in March, the breakthrough came. We got our first investor who committed $1 million. And then, we closed our pre-seed stage funding at $2 million. And that was March of this year. Alhamdulillah, we have closed $5 million more. So I am standing here in front of you, telling to all students, and especially to the girls, there is an opportunity out there if you strongly believe that you can make a difference. It's not easy, I'm not saying it's easy, but if you believe in it, if you want to do it, if you want to make a change, if you want to deliver something new to the people, you have to bear all the pain. Even childbirth is a process, जो कि एक natural process है, वो भी बगैर pain की नहीं होता. So anything which is worth it, anything which is beautiful and creative requires your ultimate, the last level push in order to have the product in front of you. So I think if I close this, I don't even call it a speech, it's just speaking my heart out. I will just close this thing. I think what COVID has taught us, what is the new norm for me, what I learned in this process of my journey of starting, I still remember one thing, hi bichari gayi, कहाँ 20 लाख तनख्वाह ले रही थी, अब अपने husband से 200 रुपए लेती है. So I just can't forget that time. So, but the thing which I have learned as a new norm is, there is always hope. And what is hope? Hope is having light and thinking that there will be a light when you're surrounded by darkness. So let's all be hopeful, let's all put our efforts together, let's work for what we believe in, and let's deliver. Thank you.